Sociocultural factors play a vital role in shaping perceptions and attitudes toward mental health. Different communities may view mental illnesses through unique cultural lenses, influenced by long-standing beliefs, traditions, and values. For instance, in some cultures, mental illness is still heavily stigmatized, perceived as a spiritual failing or a lack of willpower, leading to individuals feeling shame or isolation. Conversely, increasingly progressive sociocultural movements advocate for a clearer understanding of mental health as a legitimate aspect of human well-being. By conceptualizing mental health as part of broader sociocultural contexts, we can better appreciate the diverse experiences individuals face when dealing with mental illness and develop more culturally competent approaches to care. The latter part of the 20th century saw the rise of patient advocacy groups that have become instrumental in changing the discourse around mental health. These organizations serve as critical voices for individuals living with mental health conditions, ensuring that their needs are represented in policy discussions and public awareness campaigns. By raising awareness about mental health issues, advocating for policy changes, and providing necessary resources and support, these groups have significantly impacted how mental health is perceived and treated. The grassroots nature of many of these organizations illustrates the profound impact community engagement can have in driving change, empowering individuals to share their stories and stand united against stigma and discrimination. The civil rights movement of the 1960s and 1970s was pivotal not only in addressing inequalities rooted in racial discrimination but also in bringing attention to the systemic biases prevalent in mental health care. This movement sought to challenge discriminatory practices that marginalized individuals with mental illnesses, particularly among African American communities. Activists highlighted how institutional racism affected access to mental health services, treatment quality, and public perceptions of mental illness. By framing mental health care as part of a broader social justice issue, the civil rights movement underscored the necessity for culturally responsive care that addresses the unique needs and experiences of marginalized populations. This intersectional approach helped pave the way for more inclusive mental health policies. The feminist movement emerged as another critical force in altering perceptions about mental health, particularly concerning women's experiences. By challenging traditional gender roles and societal expectations, feminism illuminated the specific mental health issues faced by women that had previously been overlooked. Advocacy for mental health discussions surrounding postpartum depression, anxiety related to societal pressures, and the psychological effects of discrimination and inequality highlighted the need for gender-sensitive care. By asserting women's rights and emphasizing the importance of mental well-being, the feminist movement has fostered greater awareness not only of women's mental health but also of the broader implications of gender on mental health experiences, leading to more inclusive treatment methods. The transformation of societal norms surrounding mental illness has been influenced significantly by advocacy and awareness campaigns. As these initiatives have gained momentum, they have promoted a more compassionate and informed understanding of mental health. Language and discussion around mental illness have evolved, reflecting a shift toward destigmatization that prioritizes openness and acceptance. An increase in the visibility of mental health issues in media, literature, and popular culture has further propelled this change, normalizing discussions of mental health experiences and encouraging individuals to seek help. By fostering a more judgment-free environment around mental health, society has moved toward recognizing mental illnesses as valid health concerns deserving of care and respect. The concept of intersectionality is vital to understanding how overlapping identities, such as race, gender, sexuality, and socioeconomic status, impact individuals' mental health experiences. Social movements focusing on these aspects emphasize that mental health cannot be viewed through a singular lens, as various factors contribute to one's mental health challenges and the access to care they receive. This understanding fosters discussions about how to create more inclusive and effective mental health services that cater to diverse populations. By recognizing and addressing the specific needs of individuals who navigate multiple marginalizations, we can better enhance advocacy efforts and improve the overall delivery of mental health care across varied communities. In conclusion, the interplay of sociocultural factors and influential social movements has significantly transformed mental health perceptions and advocacy efforts. Continued advocacy and awareness are paramount for reducing stigma and improving access to mental health care. As we move forward, social movements will remain a critical force in pursuing policy changes that promote inclusive mental health practices, ensuring that diverse needs are met. By integrating cultural contexts into mental health care delivery, we can pave the way for more effective and equitable treatment options that honor individuals' unique experiences. Ultimately, fostering understanding and collaboration across various social movements will reinforce a mental health framework that is accessible and supportive of all individuals.